This is Healthbeat. I'm Mia Malan. Fraud and corruption cost the healthcare sector billions of rands each year. And it's not just that. These twin evils tear communities apart and damage democracy. It often leads to the redirection of public funds and bad services at public institutions. And it's patients who are the victims. Here's how corruption can affect healthcare.
Tembisa, 40 kilometers northeast of the Joburg CBD, has been around since the 1950s.
I was born here, I grew up here, I did my high school, my primary school here.
Xolani Mnisi is from the Tembisa Community Forum, a youth-led movement to improve service delivery. Apart from wanting to clean up the streets of Tembisa, making sure people get the health services they need is a priority.
Other Tembisans do share the same sentiments that we are not entirely happy. That's the reason why last year we marched to the Tembisa hospital to send a memorandum of grievances from Tembisans.
Tembisa Hospital is an 840-bed facility that serves about 2 million people. It's a tertiary or specialist hospital, which means patients are referred here from Ekurhuleni, Joburg, Tshwane, and from surrounding informal settlements.
We know that Tembisa Hospital is quite undercapacitated. It is not only rendering services to Tembisans, but also other surrounding areas, including areas like Deep Sloot. You will find doctors that are dealing with high number of patients, really much affecting how service is given to patients.
People dread having to go there.
This is not on. Guys, I'm here in Tembisa Hospital right now as we speak. Look how our human beings been stored. I may call it stored.
Residents will go there, and when they come back, they'll be having appalling comments about how they were treated, from casualty, even in wards.
This video, published by News 24, has earned the hospital a poor reputation.
It is precisely this video that prompted us to stand up as the forum and as the community to go and protest at the hospital. And I was very much aggrieved, because I've been in that hospital casualty on a weekend. It would be very much scary.
Last year, a new ward with 36 more beds was built, and Gauteng province has plans for a 300-bed mother and child facility.
So we do acknowledge that the staff that side are trying their best, and they're undercapacitated, and government is aware of that. We expect government to do something about it.
In September 2023, the Special Investigating Unit began delving into maladministration at Tembisa Hospital. This after News 24 investigative journalist Jeff Wicks reported on how crime syndicates extracted up to R1 billion from Tembisa Hospital with the help of hospital staff.
People receive parlous treatment in public hospitals because of resource constraints. That this is the same hospital where a man starved to death because the nurses forgot to feed him. So it speaks to systemic issues.
His investigation into the murder of Babita Diokaran, a Gauteng Health Department accountant turned whistleblower, uncovered the graft she died trying to expose.
She found that companies that had no public presence and had very strange names were getting tens of millions of rands worth of business in very quick succession. And she also found that the pricing of the contracts was very strange. We saw thousands of transactions being processed by Tembisa Hospital in a matter of months, and for incredible items like children's skinny jeans, for bonded leather wingback chairs, for arts and craft supplies. Millions upon millions of rands were just being channeled out of that hospital.
This unchecked spending can only hurt healthcare for ordinary citizens.
And it also gives us a window into Perhaps this is happening elsewhere. What about other government hospitals and clinics? Because also what we found was that these same companies that were doing a roaring trade at Tembisa were also getting contracts from at least 5 other health facilities in this province. So this is not an issue surrounding a single hospital. This is an issue that really underpins public health procurement in South Africa.
The SIU has confirmed that Tembisa Hospital contracted suppliers who intended to cash in on deals without providing services, and that there were irregularities in the bid documents. Although 6 men pled guilty to Diokran's murder, there's been no action against those who ordered her killing. Alex van den Heever from the Wits School of Governance says corruption in the health system can happen when individuals exploit gaps and take a chance. But it's corruption that comes from the top that's the most difficult to deal with.
Top-down corruption is when it's organized from leadership level. And that is really the one that has a systemic impact on the performance of the health sector or any facility, because it's from the leadership level, allows them to essentially establish networks of corruption, which make it much more difficult for accountability structures to operate, and therefore they're making decisions about procurement and what gets delivered in their own private interests, not in the public interest, because it effectively collapses the effective delivery of healthcare services across the board, quite aside from the money that gets lost.
We have this thing called the Health Sector Anti-Corruption Forum that's headed up by the Special Investigating Unit. So they're tasked with fast-tracking fraud and corruption cases in this sector, and that also includes the NHI fund. In your view, how will this actually protect the fund against abuse in the future?
It's not a protection at all. You know, one thing that one's got to be wary of is the establishment of what I call fake accountability structures or weak accountability structures that are easily evaded, a bit like the ANC's integrity committee. It creates the impression that there's some kind of accountability structure in place, but when you see the ultimate effect, it's really there to whitewash. Well, the key vulnerability is we allow political appointments into the administration that allow basically criminal syndicates to be set up in our public structures.
We've tried to get people from this forum and these law enforcement bodies to talk to us about the progress they've made, and all we've really found out from them from a written statement is that several cases have been handed over to the Hawks. Are you of the opinion that this isn't enough to deter fraud and corruption?
It's inexplicable that with the levels of evidence that we have against this very serious top-down corruption in South Africa, that they're unable to prosecute anybody. So this is my concern. The NPA quite clearly isn't doing its job, and the Hawks are not doing their job. And all of those structures are failing. So the SIU might do certain things and look like it's an accountability structure, but what happened to digital vibes? What happened to these cases? The people that get implicated in them are still running around, despite the fact the SIU provided the evidence. So quite clearly, somebody's perfectly happy for that information to go out, but when it gets to the actual rubber hitting the road in terms of investigation and prosecution, it all just goes into a black hole.
Is it even possible for something like the NHI to work? And if so, how?
From the very outset, they don't make sense from the perspective of an improved health system. My concern with the NHI proposals, and which render it basically unworkable, is that it is designed for patronage. It's not designed for public health.
Back in Tembisa, Olani says they just want decent health services.
The honest truth is that normal people don't care about tenders and stuff. The only thing that they care about is the services that they receive. But unfortunately, such issues of corruption, they do have a bad effect in terms of service delivery, which we cannot run away from. And we're hoping that the law enforcement will take its course. However, we will also continue doing what we do on our side as civil movements to say, while the law is taking its course, the government, the provincial government, and the officials must ensure that people are not affected.
After the break, how South Africa's largest private medical scheme is affected by and deals with corruption. You're watching Healthbeat, and we're discussing corruption in the healthcare sector. In the private sector alone, this is said to be as much as 28 billion rands a year. It increases the cost of services and it affects how much you pay for your medical aid. With me to discuss this is Boto Mozia from Discovery Health. Boto, how serious is fraud in the private healthcare sector?
It's estimated that anywhere between 3 to 10% of healthcare spend across the world is attributed to fraud, waste, and abuse. At Discovery, we make recoveries of around 500 million per annum, which represents around 1% of our healthcare claims costs. So the issue is quite a serious one and has a massive and far-reaching impact on healthcare from an affordability perspective, both in South Africa and across the globe.
What's the most common thing that fraudulent people or corrupt people do in the private healthcare sector?
The first one would be what we call card farming. That involves an insured party that takes their medical card and allows their friends or their family to use the same card to get access to medical care. The next one is around what we call ATMing. And essentially what that means is often members would collude with the healthcare provider where the provider submits a claim to Discovery, and then on receipt of payment, the healthcare provider would then split the funds with the member. So we call that ATMing. The other one is submitting false claims. So for services that haven't been rendered, a healthcare professional or a member submits claims for that service, even though the service was never delivered. And then, of course, there's, submitting medical claims where you're disguising, servicing for cosmetic surgery. So somebody undergoing plastic surgery, understanding that it's an exclusion within the medical schemes, but submitting a claim that says, for example, they've had an appendectomy. Meanwhile, they've had liposuction.
How do you pick it up?
We've got, quite robust systems in place. We've got, world-class analytic capabilities where we are looking at all the claims that we're receiving within a Discovery perspective, looking for outlier trends. We also do have a team of around 44 forensic investigators who are also analyzing and auditing claims. They are supported by an additional 50 people across the businesses, which include coding experts, clinical experts, non-disclosure experts, as well as our team of actuaries and analysts as well.
Can you give me an example? So if I had plastic surgery and I claimed for my appendix that was removed, how do you pick that up? What would that team do to discover this?
Our reports will often look at you relative to your peers. So we would pick up where, certain utilization of codes more than your peers and more than our national benchmarks. And once we've picked up that anomaly, we will then audit the claims and look for suspicious behavior. We will also then engage with the practices once we have a feeling that, there is some untoward behavior. And through auditing of actual, hospital records, so we will ask for theatre records to actually ascertain what happened within that theatre event and all other sort of ancillary claims associated with that medical event, whether it be pharmacy, whether it be hospital records, etc., to kind of paint a holistic bird's eye view of that incident before we can call it fraud.
Once you've caught a fraud, how do you deal with them?
So there's an engagement process where it's an open sort of engagement process with the clinician where we present our findings and we give them the ability to be able to provide supporting, evidence around the anomalies or the trends that we're seeing. And if we identify a provider as having been fraudulent, there's then a legal process that takes place. If it's blatant fraud, ATMing, card farming, etc., those examples that I gave you, we do also have a responsibility to report them to the HPCSA, report them also to the South African Police Services. And parallel to that process, there's then an acknowledgement of debt, where the provider does kind of, acknowledge that they were, engaging in fraudulent or wasteful behavior, and then there's a payment process that's put into place. We have a zero tolerance when it comes to fraud. All monies that are recovered through these processes of forensic investigations go back into the trust that holds the members' funds as the custodians of the medical aids.
Can you give me an example of a recent discovery that you made of fraud and how that played out?
We deal with quite a few on a monthly basis. But it's the recent one would be a syndicate where it's both member and provider collusion, both involved, working across multiple practices. In that instance, our analytics are able to quite quickly pick up the relationship between those practices and the members that are involved.
Now, so many people in the country are so concerned that the NHI fund will be a really big pot of money that would be open to corruption and abuse. So what kind of rules would you like to see in place to prevent that from happening? What tips can you give?
I think it's important to note that fraud exists across all industries, whether public or private. And so you need robust processes in place to be able to detect fraud in a timeous manner, and then obviously processes in place to be able to recover those funds on behalf of the NHI fund as well. So it's a team of experts in the discovery ecosystem. As I've mentioned, we've got our forensic investigators, we've got our clinical team, we've got our coding specialists, we've also got our team of actuaries and analysts as well, working hand in hand to be able to detect fraud. So you would expect a similar composition of skills to be able to detect fraud within the NHA fund.
If you didn't have these measures in place to detect corruption and fraud, how much more would premiums have been?
So if we didn't recover on behalf of our members, our premiums would actually be 14% higher than what they are today. So as a direct impact of the work that we do on fraud, we've managed to keep contributions 14% lower than what they would be if we didn't have those processes in place.
Botomozia, thanks very much for sharing your insights. After the break, we look at how the NHI fund will prevent fraud and corruption, if at all. This is Healthbeat. I'm Mia Malan. The National Health Insurance Scheme, which will be rolled out over the next few years, has many people wondering how funding for the scheme will be protected. The fund will be run by a board that will create units whose job it will be to prevent and detect fraud. The Special Investigating Unit's Health Sector Anti-Corruption Forum will guide this. Earlier, we spoke to Bhekisisa Centre from the Public Service Accountability Monitor about checks and balances in the proposed NHI fund. Bhekisisa, the NHI is on everyone's mind in the health world at the moment. And there will be an NHI fund that is centrally controlled with a really big pot of money, the money that at the moment goes to provinces. So will this big pot of money and the fact that it's controlled by one institution open up opportunities for corruption, or will it make it easier to control corruption?
Thanks, Mia. Having a single pot of money has its merits in the sense that to some degree, there is greater ease of oversight. But by that same token, our worry is that significant amounts of money, as we've seen, when there are fewer layers of oversight and fewer people responsible, is a space where there's greater opportunities for corruption, greater space for misuse of power. So certainly that is a concern for us, especially having seen what we've seen in the context of state capture and other instances of corruption.
So let's start with tenders. What measures do we need to see? Can you give me a practical example of something that needs to be done that's not currently done?
An example of what needs to happen in the procurement space broadly is that information around tenders must be published in accessible formats online on centralized platforms. At the moment, that simply is not happening to the degree that is necessary. So there's a lot that is hidden. So even where it's not corruption per se, it's still really difficult for anyone who'd be interested in understanding, for example, are ARVs being provided at the correct price in timely ways by companies that aren't blacklisted. It would be very difficult to find that information, but actually that's really important information.
So let's say the NHI has been implemented and they now want to issue a tender for antiretroviral treatment, for HIV treatment. What are the things that they need to do to make sure that this tender will be awarded to the best candidate?
So there's one section of the NHI, the bill, for example, that requires the NHI fund to establish an information platform to enable it to make informed decision on population health needs, assessments, and so on, financing and purchasing and patient registration, a whole range of things. One of the things that can be done to improve this clause or this aspect of the proposed bill is that this information should be drawn from a variety of sources, which also include facility surveillance and routine reports and health service statistics, because we know that there's a need to involve a broader range of expertise or broader range of demographics. The other thing that would be important, and maybe this is something for government officials that is maybe not always comfortable, is that we argue, and others have argued as well, that part of the lens, the eye, the oversight, should involve civil society, should involve healthcare users.
What is the practical thing that a civil society organization should be able to do and that will help prevent corruption?
One of the things that has been shown both in research and anecdotally is that fraud within supply chain management processes, as we're mentioning in the context of health, can be limited through the involvement of stakeholders like civil society organizations. The other aspect is that where there is sunlight on the details of tenders, information that is easy to access, that is without a cost to the public. So if I were a civic actor, without a fancy medical degree or a law degree that requires me to understand all these things, or even a procurement expertise, I should be able to go online and really find the information that tells me who is doing business with the state, but also more importantly, what is being delivered or should be delivered. Corruption thrives where there is complexity, where there are many layers to things. At present, the complexity works against transparency and works against the fight against corruption.
The bill says a board will govern the fund. Is that enough, in your opinion, to make sure that there's good governance?
Governance in health, as we've seen, has been really problematic, has been far less than what's needed. On the one hand, we do feel that the bill, in recognizing the need for such a board, is fundamental. However, one of the things that for us is important is where we've seen governance structures not fulfill their requirements has been where there is too much power afforded either to the chair of that board or to the minister, as it were. In this instance, we really are arguing that there is a need to avoid an over-reliance or an over-emphasis on the powers of the minister. And so, similar to the procurement context, that there must be not a weakening, but a strengthening of the powers and functions of other members of the board in order that there is greater accountability. So that's some of what we're suggesting, but recognizing really the importance of the structures that are proposed in the NHI bill.
Bhekisisa Kota, thanks very much for your time.
It's been good. Thanks, Mia.
That's our show on how to prevent corruption in the healthcare sector. Here's to a fraud-free year. Goodbye.